You can see here there is a needle. Here, you can see here there is a needle. Oh, sorry. Whenever I try to do this, it is going. You can see the needle inside. Just see it. You can see the dimple over there, here. On this pathway, highway I will come. Now you can see needle is coming. Everybody can appreciate needle is coming. Now there is dimple and now needle is inside. Very simple thing. And those who had done intra-amniotic saline, they feel that it is not difficult at all. And nowadays, it is hour of need or need of hour. Because single child, no. Nobody wants child with anuploidy. We are running Oscar clinic, one-step solution for anuploidy. Before that, anuploidy was done 1988. Langdon Down has told about trisomy 21. And they are called idiots. Somebody we are calling it idiots, that idiots with this thick neck. Now we are calling idiot to everybody. But ideally, Langdon Down has told this all community are idiots. So it is not new thing, but it came into market after 100 years. That people can see that this you can see with ultrasound. And thanks to Professor Nicolaidis, he had made this thing very much popular worldwide. This is one of the patient testimony.
मेरा नाम शीतल मकवाना है. मेरी एज 39 ईयर्स है. मुझे सेकंड प्रेगनेंसी डायग्नोज हुई है. उसमें बिकॉज ऑफ द एज मैंने ट्रिपल मैचर करवाया जो ऑब्नॉर्मल आया. उसके बाद में मैंने एमोसिंथेसिस करवाया. उसमें फैक्टर 6 क्रोमोसोम की अबनॉर्मलिटी आई. उसका मैंने एमियोसिंथेसिस फ्लूइड से ही फिक्स करवाया. और अभी डॉक्टर मनीष पंड्या के वहाँ पे नॉर्मल डिलीवरी की. और मेरी लड़की 3.5 kg की है. एक प्रेजेंट मेरी एज 39 है. तो आई एम थैंक यू फॉर ऑल द टेक्निक एमियोसिंथेसिस और डॉक्टर मनीष पंड्या. थैंक.
This patient was diagnosed with high risk because of her age 39 and there are risk factors of trisomy 23. So they are worried. So they came to us and we had done amniocentesis. In amniocentesis, she has got all things is normal except chromosome 6 has got one right way. So it gone for fish of chromosome 6. It turned out to be normal and patient is fine. So you can give this much benefit to our patient, and this is her patient same video. Whenever you are trying to do any amniocentesis, just look for single deepest pool, SDP. Whenever you find there is deepest pool like this, here you can see deepest pool like this, you have to insert your needle. You can see the needle is going. You can see the needle is going. Any machine, anything where you can do, you can see the needle is there in the red circle. The needle is there in the red circle. Eco tip needle is there. You have to remove 20 ml of Riker, etc. Try to do as much as aseptic, because these amniotic culture cells are very fragile. So if there is infection, you can't get any information. So you have to do like this. You can see needle is inside. You can go for it. Then reports come. This is patient at 37. When fish is there, trisomy 10, nothing is there. Patient is happy. But if patient has got a previous child with pulmonary surfactant metabolism dysfunction, this lady Rutwa Amit Mori has got 2 kids died because there is no surfactant in the womb. 2 female died. Then she came to us that what we can offer. We can offer a pre-genetic diagnosis like with this fish, that is this amniocentesis, and we had proven that the Rutwa's baby confirmed to have carrier of pulmonary surfactant because it is was there on both ends. So she was carrier. So third baby was live. So you can offer a good clinical outcome to this type of patient when she has got already lost 2 baby in you. Nowadays, ducen muscular dystrophy. This is a very recent report, 23/6/23. Okay, this patient has got 2 DMD child. 2 DMD child died. Now she has got 3rd pregnancy and she is buried. So we had done amniocentesis and it proven that this baby is devoid of exome sequence of DMD. This baby. So this baby we can survive, and it is recent one, so we can see that how this baby delivers and everything will be fine. Lataben this is another patient with orthorhinitic transcarbamylase deficiency. For this type of patient there is ammonia cycle absence. So patient cannot convert. So ammonia will be accumulated in the body and baby will die. In this type of patient, we have to go for amniocentesis with maternal blood check. So many times maternal blood will be there, so you have to send separate maternal blood also. And you can have a good baby diagnosis that baby is either a carrier, not the dominant one, so you can continue the pregnancy. If it is dominant one, you have to terminate the baby. So there is lots of advantage of amniocentesis. Simple thing, just do it when you are in doubt. So when and how? How it is very easy, but when you are in a dilemma. This patient has got progressive pseudo arthropathy, and this patient has lost Rajuben, Amrabai Goyal has lost so many baby. So we have done amniocentesis on this, and now you can see Rajuben baby is highly likely to be affected. Even though fourth child is also affected with this, so terminated this child because there is no need. When baby comes out, they will die. So you can give this prognostic diagnostic criteria to our patients. This is fish for trisomy 21. Patient age is 37 years, so it is justifiable with high risk patients. Now you can see this patient is of 20 years. Even though we had gone for fish, because patient has got 2 pregnancy with severe IUGR and baby died in early neonatal life. So you can diagnose for this type of patients also. This is Gayatriba Jaipal C, 31 week. Because of age related risk, we can go for amniocentesis, baby is very fine. Now you can see this patient has got only 20 years. Thanks to our all fetal medicine specialists fellow. Because now they are want to diagnose URSA, they want to diagnose hypoechoic focus in left ventricle. Whenever patient sees this type of report, there are some gray zones in ultrasound. Just put this isolated marker of hypoechoic focus in left ventricle. If it is isolated, Manojji, we have to do anything? Nothing. But patient, when we are reporting on it, just let it isolated bronchial cyst or isolated choroid plexus cyst. Patient magaj mein gaanth hai. And I think that patient had gone for termination because of that isolated choroid plexus cyst. So there are some gray zones in ultrasound. If you are doing ultrasound by yourself, Sangeeta madam, जो कल से मैं आपको बोल रहा हूँ, then you are more able to give more justice to your patient. And ultrasound is not difficult at all. मैडम कहेंगे सेक्रेटरी मैडम डिफिकल्ट है? नहीं, कुछ नहीं है. जो मैं कर सकता हूँ आप कर सकते हो. मेरे लिए इम्पॉसिबल का वर्ड का मतलब है आई एम पॉसिबल. मैं कर सकता हूँ तो आप सब लोग भी कर सकते हो. प्रीवियसली हमने अल्ट्रासाउंड का वर्कशॉप किया था, सब अल्ट्रासाउंड लाइव भी दिखाए थे. सो इट इज वेरी इजी. एंड दोज हु वांट टू लर्न, contact Sangeeta madam. We are planning for Zoom classes over here. So I will teach you. जितना मैं ज़्यादा पढ़ाता हूँ, जितना ज्ञान को भेजता हूँ, बखोरता हूँ, जितना मेरा ज्ञान बढ़ता है. So for my sake, you enroll with the Sangeeta madam for ultrasound teaching. So with this 20 year of age, we have done fish because she has got URSA and echogenic intrafoci in the left ventricle. Patient turned out to be fine. So you can give this type of things to our patient. This patient is again 34 years. Patient is worried for trisomy 21. We have gone for this. So in summary, amniocentesis is diagnostic genetic test to offer pregnant woman with high risk of a child with genetic abnormality in those with positive screening result. Thanks to this double marker, triple marker, NIPT, they has given us the opportunity to do amniocentesis, and we can give better result, better perinatal, because this conference is also of ISOPAR. So Raipur ISOPAR. Now neonatology is also there. So to give good baby in the hand of mother. You can all know that our purpose is to see Down syndrome, sickle cell, spina bifida, cystic fibrosis. Spina bifida we can diagnose easily with ultrasound, so there is no need for going for spina bifida for amniocentesis. But for ducen muscular dystrophy, orthonetic, ammonia, you can have surfactant deficiency. All this purpose you can go for amniocentesis. Risk is very low with amniocentesis. Miscarriage are very low. C has got little bit high risk. Procedure is very simple. You can get result within 13 to 14 days. So you have to take this window. Amniocentesis you have to do at 14 to 16 weeks. You can have a fetal fibroblast. You can culture it. Highly accurate. Little bit high sensitive for risky patients. So main need is difficulty because they are necessary to enjoy success. जब तक हमको difficulty नहीं है कि we can't go for success. I am happy that so many companies, I am speaking for dydrogesterone since last 23 years, and now 43 companies are using my paper, and these are some images they had made, because out of my paper you can see downstairs there will be Pandya MR. All these papers are belongs to me. So thank you for giving me opportunity to be on a part of this GIF. Abha madam, do you have any problem in your life? Of course. Sangeeta madam, do you have problem in your life? बहुत ज़्यादा. Can you do anything about it? हाँ, just relaxation है जो ऐसे, then don't worry. So
गानी चाहिए actually.
this Baba says,
कहते हैं, the time to be happy is now, and the place to be happy is here, and the way to be happy is to make someone happy and have a little heaven right here.
so everything is here, just have a little heaven right here, and I will take 3 minutes of all of you just voice swap at them. This is what I am talking about, PPH management. This is comog MG needle. This is comog MG needle, straight and curve needle. I will just play the video. This is comog MG needle. Straight needle has got polyglycolic acid. It is passing through the isthmus. The needle is coming back at the level of isthmus. Straight needle. It is gently pulled out and the thread is cut. This thread is cut. Now we have got two here. This suture is going up, which is free. Batao. With this simple thread, you can have a thrombotamponade as well as myotamponade. It
This
is
is
a
free
combination
loop,
of peeling
which
with
is
pollen.
going up. Uterus the bosom, which is applied at the level of fundus, which artery marrow. This will compress the endometrium.
Myometrium, sorry.
This endometrium.
So this is just like
Copy now.
prestige of peeling. And now we
Agad
have
karo.
this is second
Second
reason.
holder. This needle again is passing through the avascular area of broad ligament in the posterior segment. Sister Avakash. This will compress the uterine artery posteriorly. So with this single modality, you can have a uterine compression, uterus compression, as well as occlusion. Thank you.
So you can see that this is, and whenever you are in doubt, there is a barcode is also given. So if you just scan that barcode, you will see all this procedure live. With only myotamponade, you can have a 60 to 70% control of PPA. But if you combine with myotamponade with thrombotamponade, 90% circulation will go. Rather than going for internal iliac stepwise devascularization with this simple bilateral, you have to do repeat on opposite side also. You will completely obstruct the 80% of blood supply. Yes, madam. I want some question from you only.
Sir, what you did was you did a modified peelage with Vicryl and you did lines with again Vicryl.
Yeah.
We do the same thing when we do catgut. That is what I was not comic number 2.
Yeah, yes, madam.
Because there are studies which say that Vicryl absorbs later on and
Yeah.
it many times causes necrosis of
Yes,
the
madam.
myometrium.
Madam, abhi suno. We had made this needle with catgut only, 2 number catgut only. But when we had got abroad, catgut is only available in India. Abroad, catgut is not available because of cow disease. So we have to switch over from catgut to polyglycolic acid because we don't want to make this thing available only in India. That's why we have switched over from catgut to polyglycolic acid. And believe me, three students are doing dissertation on it. We had compared catgut with Vicryl also. We had because previously we had made with catgut only. But when we had gone to RCOG, Royal College, they told that if you want to publicize worldwide, forget about Vicryl, forget about catgut, forget about catgut because catgut is only allowed in India, Sri Lanka and Nepal. If you go abroad, catgut is not available also.
And number 2 is not available.
Number 2 is available because whenever you are going for higher thickness, there will be, this is from kid gut or it is from the cow gut.
I just wanted to know that did you observe any such tissue necrosis with Vicryl?
That's why madam, we have given dissertation to 3 students and we'll come with paper the comparison of this catgut versus Vicryl when patients are going for second cesarean section or madam, you have not pointed out, we had also worried about the intestinal obstruction because this loop will go. But when there is a chance of PPH, better to do risk versus benefit ratio. Here you are controlling PPH, you are saving the life. If there is intestinal obstruction, we will do it. But till date, there is no intestinal obstruction observed because we are putting it very tight, so it will go inside. And nowadays we are suturing uterus with Vicryl only. So many times we are suturing. Now nobody is suturing uterus with catgut. How many of you are suturing uterus with catgut? Because 150 rupees Vicryl is available and catgut is available at 300 rupees.
No, that is true.
So if there is no problem with suturing with Vicryl of 2 layers, then there should be no problem with this necrosis also. We will wait for that result. That's why, because we have changed from catgut to Vicryl because we want to give it benefit to the worldwide. And when we are going for patent at London, they say that catgut will not be
What
allowed.
is the cost?
500 rupees only. And both the side, if you do it, believe me, you are controlling 80 to 90% of blood loss because you are doing B-Lynch with O'Leary. And believe me, why B-Lynch? Second question, how many of you have done B-Lynch? Is it easy compared to this? It is easy compared to this. If we compare, it is the same, but you have to go one deep.
No, modified billion जैसे ही होता है.
It's same. But if you are doing with B-Lynch, you have to require more curved needle.
No sir, हम straight में डाल के करते हैं.
यही मैं कहता हूँ ना कि what is difference in B-Lynch and this? You have to use straight needle because myometrium is very thick.
Yeah, that is why.
That's why there is modification. I had met B-Lynch in the conference at Hyderabad. Why B-Lynch used to take his own needle when he want to go for B-Lynch stitching. Original B-Lynch wants to go, but there is a big needle. And believe me, when we have started this technique, we are going with our own big needle. जैसे मैडम आई में पुरुष के वो गोदरेज सिनी की नीडल है, जो आप बनाते थे ना रुई वाला गद्दा, उसकी नीडल है, क्योंकि that much thick needle you want. Then afterwards commercialization was made. So this is modification, but this modification you have to do with single puncture and you can have a 2 different needles. So it is same thing, but you can control myotamponade as well as thrombotamponade. Because only thrombotamponade doesn't give you 100%, only myotamponade doesn't give you a full percent. So with combination, you can have at least 80 to 90% stoppage of blood. When uterine artery comes, we convert it into arterial spiral arteries. Madam has rightly told in his presentation. When it comes to the end arteriole, their pressure will be very low compared to the uterine artery. That's why if you don't cut the placenta eccentra syndrome, don't see as the placenta, believe me, it is just like your wife, don't touch it. Don't treat it as a girlfriend. Don't touch it. So this is True Glide company. It is company available. The person has to come here, but it is not there. No, you will order. You can keep this sir, for your educational purpose. Yes sir.
एक मिनट सर.
बोलो.
सबसे पहली बात तो ये है कि मैं आपका बहुत ही शुक्रगुजार हूँ बिकॉज आई एम अ न्यूरोलॉजिस्ट एंड जिस दिन भी किसी शहर में एम्नियोसेंटेसिस आ जाता है दैट इज कॉल्ड एज विकास डेवलपमेंट बिकॉज whenever you talk of congenital anomalies and amniocentesis, So I salute you, sir.
Thank you, sir.
That
Thank you.
You are hitting at the key subject of diagnosing
Congenital anomaly in utero.
and preventing them. This is number one.
Thank you.
I admire you for technical things. I admire you for motivating for happiness. And
Thank
I
you.
admire you as a great innovator जो मेड इन इंडिया को दूर दूर तक ले जा रहा है.
Thank you. Thank you.
I salute you.
Thank you, sir. Thank you. So kind of you, sir. So kind of you. And in 2005, when I had written a book of fetal echocardiography, that was people are not knowing about fetal ecography. And at that time, USA government has offered me HB1 person with extraordinary ability visa. I had gone with my two kids. My both daughter are doctor. We are all from BJ Medical College. Younger one is just passed dermatology with gold medal. Older one is pediatrician with gold medal. So at that time, when she was of age 8, they don't drain our brain ready. We will be there in India. So I am based in very small place at Surendra Nagar, and I am happy with my own place because after all, बहुत सारे कमाने के बाद आपको लगेगा कि आपके घर पे काम करो. मैडम खत्म करना. थैंक यू. मैडम ने से घड़ी देख ली, चलो बात खत्म करो. थैंक यू वेरी मच. थैंक यू फॉर गिविंग मी टाइम. एंड ऐसे 3 बार आया, ऐसे 30 बार बुलाओगे तो भी मैं आऊंगा. आई एम वेरी हैप्पी. थैंक यू मैडम. थैंक यू सो काइंड ऑफ.
Sir, a very nice lecture on amniocentesis.
यस.
Sir, I have two queries.
यस.
Leaving the theoretical part apart, what are the practical challenges that you face while doing the procedure and after the procedure, including RH sensitization?
Yeah.
This is the first question. And second, sir, what is the last week up to which we can do this amniocentesis procedure?
Answering your first question, when there is RH incompatibility, we have to give NTD, number one. Whenever there is RH negative patient, try to do minimize leak because we are worried for maternal blood leak into the fetal blood leak into the maternal circulation. When there is RH compatibility below, so try to minimize that thing. Once we are seeing that there is no insertion in the placenta is posterior, you are just putting needle through the abdominal wall. There is least chance of feto-maternal hemorrhage. And even though we are giving NTD with any procedure, if you are doing oocyte, so same thing you have to do. If you offer this up to 20 to 24 week, maximum in India nowadays 24 week is the termination site. Ideal age is 16 to 18 week. Because with this 15 days you can get the report and you have got termination chance up to 20 weeks. But now government has given us opportunity to deliver about the baby up to 24 weeks, so you can increase the limit. But ideally 16 to 18 weeks you can do it. You have to take maximum of 20 ml of fluid and wait for 10 to 14 days. Yes sir. Second question.
An anomaly is detected after 24 weeks, because we sometimes find some patients who come after second trimester completion. So, are we in a state of doing amniocentesis beyond 24 weeks? Sir? Is there any scope of doing that?
Then we have to take permission from the court. Because then it comes to medical legal purpose, and for medical legal purpose you have to take permission from the court, because nowadays nobody want to take risk.
Yes,
So
sir.
better to do ultrasound TIFA in early trimester scan.
Right.
Better to select those community of patients who have got 2 nitrate surfactant deficiency, those who have got 1 death with amniotransferase enzyme deficiency, ducen muscular dystrophy. So select the high risk group and do amniocentesis at early age, and you can give the benefit of aborting baby up to 20 weeks. So don't wait up to 24 weeks. And if suppose 24 week baby comes and if you find anomaly, then why you want to go for amniocentesis?
Right.
You have to just go for abortion.
Sir, but there are some anomalies which are not that much lethal. As
That much lethal.
Yeah.
So then we have to take opinion of 2 gynecologists and you have to subject to the court. Now everybody is going in the court for abortion, and so you can take the help. Yes, madam.
Thank you, sir.
Sorry, sir, there is no need for going to the
Court. Yes.
Now there are boards in all the district hospitals as well as in the medical college, and they had a team, and the problem gets solved there only. Whenever a patient goes to the court without asking all these
This
authority,
committee.
then there is problem, because even police personnel
They
are
don't know.
confused कि कोर्ट से परमिशन लाना होता है कि नहीं लाना होता है. कुछ नहीं करना होता है, किसी भी गायनेकोलॉजिस्ट
So medical college में there are setups.
Medical college as well as district hospital.
Okay.
Each district hospital has a medical board for termination of pregnancy after 24 weeks also.
Thank you, madam.
Sir,
Yeah.
Sir, just I want to tell for isolated marker,
Hmm.
we just report sometimes to document.
Yeah.
We know it's not very,
Sir, we know that, but patient doesn't know.
yeah, we have to document it.
We have to document because we had seen it. If
Yeah,
we
yeah.
don't document, then it is also problem.
Problem, yeah.
But if we document, then patient will hanging on madam that madam ये है अभी आप क्या करें?
Yeah, yeah.
Then we have to go for at 20 year of age also we have to go for amniocentesis to prove that normality.
Yeah, yeah. But we can counsel also patient कि इस ज़्यादा कुछ निकलेगा नहीं, बस suggest some finding and we'll do follow up and आपकी मैडम समझाएंगी डिटेल्स में.
लेकिन सर गूगल डॉक्टर है ना बहुत परेशान करते हैं.
जी जी.
वो गूगल डॉक्टर पे देखते हैं then they are more worried and it is better to confirm. Now that it is very easy things.
Yeah.
Thank you madam.
But second question, sir, are you art of living follower?
Yes, sir. I am follower of because I am spiritual person. That Baba is recently
Yeah,
died,
yeah.
and he is very fond of music and songs and everything.
Yeah.
But this two lines I found very useful for our gynecology because in gynecology we are always stressed out. So जहाँ पे है, जिस जगह पे है, वहाँ पे खुश रहे.
Yeah, spirituality helps in the progress.
Progress. Thank you. Yes, you want to ask?
Can we use the same needle for doing fetal reduction?
Yes, same needle, madam. This is the same needle. You can use it for fetal reduction, but for CBS you have got separate needle. Because CBS we have to take thick tissue.
Mostly when we are doing it abdominal.
Whenever, if you want to do abdominal CBS, this needle won't work. Because the diameter of this needle will be very small, but for fetal reduction, same needle is used. And same needle you have to do KCL 1 ml normal saline slowly and just see for fetal heart to stop. But always see that transplacental migration should be there. So placenta should be separate. There should be no communication with the placenta. वरना राम को मारने जाओगे तो लखन भी चला जाएगा. So thank you very much. Yes, madam.
High viral load. Amniocentesis can be done.
For what purpose you want to do amniocentesis? She is positive, she has got high viral load, give her antiviral. Why? If you want to prove that baby has got how much viral load?
Her NT is raised, high risk in the biochemical markers.
So suppose if this type of patient comes to you and you want to go for cesarean section, what are the precautions you will take? Same precaution you have to take for amniocentesis. That should be the courage of gynecologists. You have to do cesarean of HIV also. I have done more than 1,226 cesarean section or hysterectomy till date of HIV because I am in charge of PPTCT unit in medical college. So in 23 years we have done so many cesarean and hysterectomies of HIV patients. And you have to do it. So with this very much viral load, if you want to, if the baby has got high knuckle thickness, nasal band absent, so you have to go for karyotyping and you have to give good healthy baby to the mother. And believe me, for cesarean section you have to take lots of precaution. For amniocentesis, it's very simple. Just take universal precaution, gloves पहनिए, boot पहनिए, चप्पल पहनिए, double gloves पहन के करिए और needle डाल के निकाल लीजिए. So there is no harm because patient is moving, patient is hemodynamically stable. Wow, very good. Thank you. खाना आ गया.
Thank you very much, Dr. Pandya, for a very light-hearted talk on amniocentesis. And I just feel that amniocentesis is a thing for which proper counseling needs to be done before you do the amniocentesis. So, and there has to be a interdisciplinary involvement. One doesn't try to do everything herself or himself. There should be a team of the geneticist, the radiologist and the gynecologist. Thank you so much, sir.
So individually we achieve, together we excel.
Thank you, Pandya sir, for such a elaborate talk. And again, the felicitation and the photo session. May I request Pandya sir, please.